And I call the member for Indi.
Thank you, Madam Deputy Speaker. I'd like to address my comments this evening to the National Disability Insurance Scheme and its rollout in Indi. I strongly support the introduction of the National Disability Insurance Scheme. It is a groundbreaking change to the way disability services are funded and delivered. However, as I move around the electorate, many constituents ask me questions about the NDIS, and they are keen to find out much more about the rollout and its impact on them as carers, families or as users. The NDIS will become available in the Ovens-Murray area from the 1st of October 2017, and it will cover the local government areas of Alpine, Benalla, Indigo, Mansfield, Towong, Wangaratta and Wodonga, and it will join the Goulburn area and cover off Murrindindi from the 1st of January 2019, including parts of Moira as well as Murrindindi. Madam Deputy Speaker, on the 5th of April, I had held 3 forums in Wodonga, meeting with staff and organisations who are on the front line in delivering disability services. And I met with key staff who have a particular interest in how the introduction of the NDIS will affect their services and clients. And these service providers covered Aware Industries, Employment Services Groups, the Personnel Group and GV Central Victorian Group Training, and the Disability Advocacy and Information Service. And tonight I'd like to address my remarks to the finding of those forums and some of the recommendations that came out of it. Aware Industries has been working for over 30 years on covering both New South Wales, Albury and Wodonga. It operates as a community-based social enterprise. It's directed by a voluntary board of management and operates 2 large industrial sites in Wodonga. And the experienced management team understands the need of the up to 115 strong workforce and has 20 separate business units. Aware is a member of the Australian Disability Enterprises Group. And on the day I had particular delight in working with both the CEO, Sharon McGivian, and also Tom Drum, the Chair, and Vince O'Neill. So it was a number of issues that they asked me to bring to the attention of the Parliament. They're particularly interested in how employment agencies such as Aware fit into the NDIS. What are the arrangements for the NDIS for people with particular organisations that work with disability? What processes will be in place to manage outcomes for clients who are in disability employment services? And how will the NDIS funding expenditure of service providers be reviewed to ensure outcomes occur that are measurable for clients rather than activity by the providers? And they ask, will Aware Industries and other providers' funding change once the NDIS is introduced in 2017? And Aware Industries request a government services and product procurement policy that will enable them to provide services, particularly stationery or health-related services, back to the government. The second group that I had the pleasure of meeting was the Personnel Group and representatives from Central Victorian Group Training, CVGT. These 2 services work in the Disability Employment Services program, and they're designed to give support to workers with a disability or mental health condition in finding and maintaining employment. And participants are given assistance to prepare for work by addressing barriers such as education, licence, ticketing, interview preparation, general work preparedness, and they can be assisted with referrals to appropriate service providers. So I was particularly pleased to meet with staff from these organisations and would like to thank Tracy Fraser, Acting CEO for the Personnel Group, and Mark and Craig from CVGT. So the issues that came out of that meeting: funding levels 1 and 2 for disability employment services are significantly different, from $3,000 and $10,000 per client at these respective levels 1 and 2. The providers note that midway during the current 5-year service contract, the previously consistent 50% breakdown of clients falling into these 2 funding levels has now slipped, such that only 1/3 of clients are now funded at level 2, which is the $10,000 rate, creating financial difficulty for providers. And providers request clarification of how Job Seeker Clarification Index is now being applied, causing this unexpected change in funding outcomes. Providers express concern and confusion on how star ratings are implemented, and their wage subsidies for disability service clients have been stagnant since 2005 and need to be increased to be relevant and effective incentive. And the third group that I met with was the Disability Advocacy Information Service, NDIS. NDIS is a not-for-profit organisation governed by a board of management. NDIS provides free advocacy support and information to anyone with a disability to ensure equity of rights and increased integration into the community. And thank you to the many people who participated in this meeting, but particularly to Martin Butcher, the Executive Officer, for Jenny Tate, Chair of the Board, and to the other participants in that round table. And I'd particularly like to call attention to Tony Reeves from Gateway Health. So the issues that they raised include that the cross-border anomalies that exist in regard to how NDIS funding is applied by states, and New South Wales has placed the majority of existing disability funding into supporting NDIS, which results in less money now being available for advocacy. DAIS received $180,000 to provide advocacy services in New South Wales. So what will happen as a result of these changes? How do clients find out about NDIS and how it works? So that whole information that this organisation is able to do, so how will they be funded? What special grants may be available to support DAIS in its ongoing service provision? They also mentioned some of the problems they're having with MyGov, particularly for clients, and they also talked about a holistic approach to disability service provision and how useful it will be in terms of housing and education and bringing those sectors into the whole discussion. DAIS have 30% in increasing number of clients with mental health concerns, and that increasingly an overlay on their ability to provide advocacy service. And they particularly asked that a workshop be funded to bring these players together with government representatives to actually look at how we can do creative and innovative and much more effective ways of delivering these services in our community. And Gateway Health in particular agreed to take a role in facilitating that. But I wanted to bring to the House the words of Jenny Tate. Jenny is a mother and a member of a board, and she has since written to me, and I'd like to put her words onto the Hansard. Jenny writes, "As a child of a parent with a significant disability and a personally actively involved in pursuing innovation and community inclusion based on true person-centred practice, this is what I want for people on the autism spectrum, often neurological and complex conditions and with cognitive impairment." And she asks that services and organisations are held accountable for the words they use. If they advertise person-centred practice, then they should prove in word and deed that they understand what this is and actually practice it, along with terms such as community inclusion and human rights. She says that segregation in all its forms, including the hidden forms, is eradicated for good. She has other comments around those, but I just haven't got time to read them tonight, because I'd like to focus some of the other points she makes. That persons with disabilities are insisted and encouraged to live in a home of their own, where supports come and go, where appropriate or required. She says it's far more effective and cost-effective and will foster true independence, choice and control. And we hope that the NDIS will facilitate that. She hopes that services and organisations are not allowed to frighten families into staying in a cradle-to-grave model in order to ensure the survival of the organisation. She says families and individuals need advocates and supports that empowers, encourages and teach people how to advocate for themselves. She asks that employment for people with disabilities become a community responsibility and that everyone understands the benefits for people, for employers, co-workers and communities of having people with a disability, including in the workforce, in a meaningful way. She asks that people with a disability are respected and valued and not derided, abused or disregarded because they are born or have acquired a disability. This seems pretty basic, she writes, but it is yet to be a reality. It's pretty sad that Australia is not one of the better countries in the world for protecting the rights of the most vulnerable in society. And most importantly of all, she writes, that people have the opportunity to choose and create a good life in community, free of control by services and organisations. They are able to live independently with quality links in community where they are known, seen, valued and have meaningful relationships. And she hopes that with the NDIS, that people like me and also Minister Prendergast, Jane Prentice, who are in a position to champion and create an uplifting social environment for people with disabilities, that we will champion futures that are brighter and that people with disabilities can achieve a good life for themselves in the same way that non-disabled people work to achieve a better life. So in closing, I bring the grievances of this community to this House, and I look forward to working with the Minister and the Department to host a forum in Wodonga where these people can speak with their own words, have their own voices heard, and together with government we can make sure that in the future we have the innovation and the creativity that we know the NDIS can bring to our border area. Thank you, Madam Deputy Speaker.